Well, good afternoon and welcome to H360 Live. My name is Dave Duplay and I'm joined here in the studio this afternoon with my friend and colleague from Healthy h360, Miss Courtland Long. Courtland, it's great to have you here.
Good to be here.
So we had a busy weekend last week. We had two walks, Saturday and Sunday.
Yep, Parkinson's and March of Dimes.
The Parkinson's Unity Walk.
Yes.
Right, absolutely. And then the March of Dimes on Sunday at Columbus Circle. And both walks fantastic. A lot of people out raising money, supporting their cause all the way around. It was a great day, and the weather on Sunday especially really cooperated in New York, so that was a good thing.
It was beautiful. We even saw Eli Manning at the March of Dimes.
Yeah, he opened it up. Big supporter. He's been there for the last 5 or 6 years, opening it up and kicking everybody off, and the walk was great. It was about 2.5 miles. And so everybody got exercise, a little sunshine, and raised money for a good cause.
Hopefully people were wearing their sunscreen.
Absolutely, I hope so too. Well, we've got a great show for you this afternoon. Dr. Sophie is back in the studio. Now remember, last time she was in here, we were talking about plastic surgery for women who have gone through mastectomy. And today we have a great show. This is one you're not going to want to miss. It's all about dog bites and general scar management. So you're going to want to get comfortable, watch this show. You're going to learn a lot, especially in the area of dog bite, which you're going to hear some really outrageous numbers when it comes in terms to how many dog bites actually occur during the course of the year. So stay tuned for that. But Courtland, as always, we've got some health tips we want to go through, and these today tie right directly into what we're going to be talking to Dr. Sophie about.
Yes, these tips are very helpful if you have an encounter with a dog. We're going to teach you how to make sure that encounter stays nice and friendly and what to do if that encounter maybe turns a little bit aggressive. So we'll just jump right in, and tip number 1 is to introduce yourself to dogs. Now, most dogs are not aggressive and they don't really want to bite, but you do need to introduce yourself so this dog gets a sense of who you are. You can safely introduce yourself by allowing the dog to investigate you, and they do this by smelling your hand. So when you come up to a dog, you want to slowly extend your hand to allow it to give it a little smell.
Yeah, absolutely. Introduce yourself to the dog. But that one is really important, right? Because you want to go slow, approach the dog, and as you say, let the dog have an opportunity to smell your hand, and that's kind of the introduction process. So great tip there, Courtland.
Well, it's a really important one for children to know that tip as well, because I know kids want to just run up and go hug the dog and pet it a lot, but children really need to know you have to let the dog get used to you first before you get in its face.
Yeah, absolutely. You know, dogs especially, you know, in the hot sun, they're, you know, kind of sleeping or relaxing. Children run up, run right for the face, startle the dog. So you do want to make sure that the proper introduction with that dog is made. So the second tip is to know the early warning signs. So most of the time, you know, you'll see a dog, and if they're happy, their tail is wagging and their ears are up, but there's some early warning signs that may give you a heads up that something might happen. And those early warning signs are the tail stops wagging, it becomes very stiff, sometimes tucked between the dog's legs. The ears are laid back on the head, they're not up and perky. Maybe you get a snarl out of the dog, or they're baring their teeth, they're growling. So those are some of the signs you want to really be careful of. Know those early warning signs. It's obvious when you walk up to a dog and they start growling or baring their teeth. That, of course, signals danger. But the ears laid back or the tail not wagging and somewhat stiff, those are some subtle signs, and you really want to pay attention to those.
Well, there are some other signs as well that are even more subtle than those, and you really want to look out for these. And it's if the dog is flicking its tongue, yawning, or just staring straight ahead. Those are some really important signs to know that the dog is not happy about the situation and could turn aggressive.
Yeah, so again, know all the early warning signs, especially the ones that, you know, are subtle warning signs that you really want to be careful of.
Well, we have one final tip, and tip number 3 is get away but don't run. If you are faced with an aggressive dog, you want to make sure that you don't stare directly at it. An anxious dog could perceive this as a threat. You want to try to slowly back away and place barriers in between yourself and the dog. And it's really important not to run. Dogs have a natural instinct to try to chase their prey. So if you run, the dog is probably going to come after you. Now, if an attack appears imminent, you want to stand still and tell the dog, no, go home, in a firm voice, but don't yell.
Yeah, exactly. Don't yell. Firm voice, right? And I like your point about not running because, you know, if you're running and the dog is chasing you, which is their natural instinct, if you happen to fall, you know, above all, protect your head and neck area. You know, if you find yourself on the ground and the dog is really aggressive and coming after you, protect your head, protect your neck, you know, get down in a ball. It's almost like tuck and roll, and really protect those sensitive areas like the head and neck. You got to watch that.
Yeah, you really do. So it's very important, again, not to run and to be firm with the dog. And if the owner's around, try to get the owner's attention so they can rein their dog back in.
Yeah, absolutely. Now, Courtland, I have to ask, have you ever been bitten by a dog?
I fortunately have not been bitten by a dog.
Okay, well, unfortunately, I have. I was very, very young, and the dog, I'll never forget, the dog's name was Tippy, and it was owned by our neighbors, Mr. and Mrs. Brown, and it was totally my fault because I broke all the rules and tips we just talked about.
Yep.
I went right immediately for the dog, and Tippy knew who I was. The unfortunate part was Tippy was a little up there in age, had one cataract in its eye, and the other one I think was lost or blown out, and so it was, you know, a little sensitive, and I went right up and my finger got it.
Oh.
On the way to the hospital, a few stitches later, eventually Tippy and I made up. We were like best friends, so, you know, but it was totally my fault. I went and I did not follow the tips we just talked about.
Well, it's good that you and Tippy made up and you weren't afraid of the dog after all that happened.
Well, we're going to talk about that when Dr. Sophie comes in because young children getting bitten by a dog, it could really leave, you know, an emotional impact for a long, long time.
Yes, it could. So there are some resources out there that we'll talk to Dr. Sophie about.
Okay, good enough. Well, she'll be in here in a minute, but first, as always, we have our video that we want to play. Our interns out in the streets of New York at Bryant Park. And you know, this one's a great video because everybody knows a lot about dogs, and you're going to hear some great information from our friendly New Yorkers. So you want to watch?
I would love to.
Okay, guys, roll the video, please.
Do you have a dog, or do you know anybody that has a dog?
I don't have a dog, but I do know people with dogs.
I don't have a dog, but my parents have a dog.
I do have a dog.
I wish I had a dog. It's a great travesty of my life. I don't have one, but I do know people with dogs.
Okay. Do you think it's important to introduce yourself to a dog before petting it?
I do.
Why?
Just to like maybe not scare the dog or like not come on too strong.
Yeah, I think you never know how they're gonna react.
Yeah, probably just like with people. You know, wouldn't just go up and touch a person without asking.
Oh, absolutely.
Why?
Because the animal knows their owner, not me. And it's just like walking up to a regular person and, you know, being in their space. You know, yes.
Okay.
I would like the owner to introduce me to the dog.
Okay. What are some warning signs you think a dog might show if they have aggressive behavior?
The hair on the back of their neck stands up. That's always a little scary. My dog is very aggressive. We're working on it.
Oh, really?
Maybe like pulling away from the owner or growling.
Probably growling, moving aggressively.
Maybe like pulling their owner if they're on a leash or like growling, barking.
What's some advice you would give somebody who's facing an aggressive dog?
I would say run, but I think they say if you run, it makes it worse.
Yeah.
So I just cross the street whenever I see a dog that I don't know.
What kind of advice?
Yeah.
Back up, be passive, don't make any moves toward the dog.
Maybe like try to stay calm, just because I feel like the more you freak out or get emotional, the dog like senses that and picks up on it.
Just the yelling. I feel that yelling and being aggressive back aggravates the situation, and that staying calm helps them to know that they don't need to be aggressive.
Well, Courtland, what'd you think?
Oh, that was a great video. You know, these New Yorkers really knew a lot about dogs and how to prevent dog bites and what to do if you're faced with an aggressive dog. I thought it was awesome.
Yeah, absolutely. And the one young lady, she said that she has a dog, and the dog is somewhat aggressive, but she's working on it.
Yes, but I want to know what she's doing to work on it, though.
Yeah, exactly. Well, you know, I can go into the parks, and especially in Central Park in the morning, you know, a lot of times it looks like there's doggy school going on. So
Yeah.
there seems to be an instructor, and they're teaching the dog how to properly walk on the leash and obey some, you know, basic commands. So maybe she's doing that.
Yeah, I hope so.
Yeah, I do too. Great video. Our interns did a great job. Our friendly New Yorkers, opinionated as always, and they do know a lot about dogs and dog bites, and they knew a lot of our tips, so good news there.
Yep.
Well, Courtland, Dr. Sophie is here with us today, and before we get into our Q&A with her, we have some data that I want to share with everybody because the numbers here are really they just blew me away.
Yeah.
I mean, there's no other way to say it. So let's just jump right in. So according to the CDC, more than 4.7 million dog bite incidents occur every single year in the U.S. That's a lot of dog bites. And of that 4.7 million, 800,000 will need medical attention, and over half of those are in children. 92% of fatal dog attacks are by male dogs. 94% of those were not neutered. So very, very important, spay and neuter your animal. Bob Barker would be happy to hear me saying that. Every year, the insurance industry pays over $1 billion in dog bite claims. $1 billion. It's truly amazing. And 75% of dog bites occur on the victim's property, and most victims of dog bites are responsible for their own dog. It's actually attacking them.
Oh, no.
Is that what I'm saying? Yes, that's what I'm saying. So, you know, Courtland, a lot of dog bites occurring,
Yeah.
a lot of money in insurance claims, and not to mention the emotional impact that it has, especially on children. So, Dr. Sophie, thanks for coming in today. It's so good to see you. How have you been?
I've been great. Thank you so much for having me back.
Absolutely. These numbers are, they just blow me away.
I know it is surprising to most people, but not to me because I treat a lot of these patients. And it's funny, I have so many friends and family members who have pets, and I also have a small child, and I never let him near the animals because in my world, everyone gets bitten by a dog.
Right,
Yeah.
right. Yeah, absolutely. And I think it was you that was telling us about the elevator door, right? Because we're,
That's-
especially in New
yeah.
York,
Well, that's the other
we
thing.
now we know, right?
yeah.
We
They
always
don't,
say,
they don't
"Oh,
always open on you.
They don't always open, so I put my briefcase in there instead of my hand. And
Please.
Courtland always says, Dr.
Thank
Sophie.
you.
Dr. Sophie would be so proud.
Yeah.
Right.
It has changed my elevator practices as well.
One
Yeah.
down, a couple $100 million to go,
That's
right?
right, that's right. Yeah.
Well, you know, again, thank you so much for joining us. Your last show with us was awesome. We got so much great feedback.
I'm so glad. Thanks.
Yeah, and you know, so Dave mentioned some really incredible numbers in the front of the show, and you said you treat a lot. How prevalent have dog bites been in your surgical career?
Well, in my practice alone, I treat about 2 or 3 a month. I'm on call for several different hospitals, so I get a lot of the trauma that comes in. My partner's probably equivalent. So I see this all the time. I've noticed they tend to occur in spurts. I don't know if it's something in the air or just a general feeling where the animals get a little bit agitated, but always a several at a time and then nothing for a little bit.
So what body parts do you usually see involved in these dog bite incidences? And I'm curious, do they differ from children to adults?
Yes, usually they do. Unfortunately, children get bitten on the face a lot more often than adults do. Maybe they're just closer down to the animal, closer down to the ground. They tend to lean in more. Both children and adults get a lot of dog bites on the hand or fingertip in particular. I see many more dog bites on the arm or the leg in adults. Sometimes the adults are standing and the dog bites into their calf, that sort of thing. But unfortunately, the people who get hit in the face the most are the children.
Wow.
Wow. So in our show today, we're also talking a little bit about scar management. So when a victim comes to you and they've been bitten by a dog, how do you assess what the scarring is going to look like, and also how do you determine the treatment protocol for that bite?
Right, so that's something that I get asked about a lot, and dog bites can be complicated for a couple of reasons. One is, as opposed to getting sliced with a knife or a piece of glass, it's usually not a clean cut. It's usually a tear, and it's usually contaminated with a lot of bacteria, and the edges are usually very uneven, and sometimes it's a little hard to tell how deep it got depending on the different lengths of the different teeth involved. The other thing is sometimes you have to open the wound a little bit more because there can be little bits of teeth left behind, which you didn't think might be there, and then you have to go after. And then the other thing is when tissue gets torn, which often occurs, sometimes it looks like it's kind of okay, and it may take a few days for it to, as we say, declare itself, that it's actually not going to make it, and you might end up with a much bigger hole, for lack of a better word, than you started with.
Yeah, now you also mentioned that these wounds sometimes have a lot of bacteria in them. So in particularly bad cases, how do we prevent infection?
So this is one of the things that's specific to dog bites and also human bites, by the way, is that there's a lot of bacteria in the mouth. And a lot of the bacteria that's in the mouth is different than the bacteria that lives on the skin. Most of the bacteria that we have on our skin is aerobic bacteria, meaning it thrives in an environment with air, or meaning oxygen. A lot of the bacteria in the mouth actually live under the gum line, and they're anaerobic. So even though they're in the mouth, which is open to the air, they're hidden under the gum line deep enough that they actually thrive without air. And this is something that I often have to explain to my patients or the parents of the patients who see this tear and they want it closed up. One of the worst things you can do in a badly contaminated dog bite wound is to close it up right away, because that bacteria that's in there, even if you rinse it out really well at first, once you trap it and take the air out of the equation, it actually thrives, and it can make the infection a lot worse. So sometimes you have to leave the wound open, let it heal on its own. It will turn out to be a worse scar initially, but that's what you have to do to avoid a worse situation, and almost always we give antibiotics as well.
Wow. So you're a plastic surgeon. Do a lot of the people that you treat, are they treated in the ER by an ER doc first, and then, especially if it's a head or neck, especially the face, in a young child, then do you come in and really take a look and say, okay, how can we minimize this scar for the rest of your life?
So what's interesting about that, and a lot of things I do, is there isn't really an absolute standard. Every hospital, every ER, every urgent care facility sort of has its own way of doing things. And in some places, the emergency room physicians are very experienced in managing these problems, and they feel comfortable dealing with them on their own if they're not very complicated. In New York, the majority of the time, the standard is that you would call a plastic surgeon because we're available, and we feel that bringing our expertise into the situation is actually really beneficial for the patient. But the other part of that is it's not just the first stage, it's the follow-up. Especially if you leave a wound to heal on its own, it might need to be revised later. Even if you are able to close it, it may need scar management, and also just monitoring beyond that first day to make sure it doesn't declare itself into an infection or further loss of tissue.
Yeah. Now, if you look at bites that occur on the hands or on the face, are there certain areas that are more difficult to treat than others?
So in plastic surgery, we talk about aesthetic units, so isolated things like the nostril or the tip of the nose or the eyelid. And unfortunately, in the face, there are a lot of those areas that are irreplaceable. So a lot of the dog bites we see in the cheek, for example, if they're small, they're usually not that difficult to reconstruct. But for example, if the whole tip of the nose were missing, it can become very complicated and involve several stages of surgeries to get it back. Sometimes it never really gets 100% back. So the nose is tricky. Ears are sometimes also very complicated. Anything that has different kinds of tissue and is pretty much unique to the body.
Yeah.
So in dog bite cases, what's usually involved in a comprehensive medical and surgical evaluation, and how important is it to have that done as soon as possible?
Well, it's pretty important because you want to make sure that the right people are there to assess whether the wound sometimes needs to be opened further and explored, how to make sure it gets washed out properly, whether it should stay open or not, how it should get repaired, and then follow up. I would recommend that if you were bitten by a dog, you should probably go to the ER right away. The other thing is, as we talked about, beyond the face, there are so many dog bites to the hand, and the hand is a very tricky area. The hand has a lot of very small structures in very defined spaces, and an infection in the hand can sometimes not be obvious right away, and it can be down deep in very small areas that by the time it comes to the surface, you have a really big problem and your whole hand is potentially compromised. So I would recommend getting treatment with as many people as possible in a proper ER right away.
Yeah. Now, some of these dog bites, the people that are bitten actually know the dog. So it could be a family dog, it could be a pet of a friend's, and and we don't mean to bash our canine friends here in any way, shape, or form, because our feline friends are, whoa, it could be right. A cat bite could be just as significant here, but that's another show. So, they know the dog. It could be theirs, a friend's. They get have an accident, the dog bites, and they're in the ER, and the psychological impact, especially on young children, especially if it's a family pet. What resources are available to the family at the time that they're in the ER to help kind of manage that psychological impact that might occur after the fact?
Right, so unfortunately, as with many things, the mental health aspect of this problem is often not dealt with, at least not immediately, unless it becomes very severe. So in the initial stages, it's control of the infection, management of the scar, obtaining follow-up, that kind of thing. More time than not, the dog stays where they were, and then the person who was a victim of the bite has to just sort of live with it. In my experience, it's almost never that one of the victims tells me they didn't know the dog. It's almost always their own, their neighbors, their family members, and a dog they've played with many times before who they're going to be in the same room with again. And unless the person specifically seeks out some mental health support, they're usually not automatically referred it. With the children in particular, whenever this occurs and I'm taking care of one of these children, I make it a practice to speak with their pediatrician, and I will usually also mention that part of it. So as part of their routine health maintenance and care, if they do need some support, they can get it. Then the other part of it too is, if it's the family pet in particular, as you said, it can be very guilt-provoking for a child if they feel like they want the pet out, but the family loves the pet so much.
Right.
So these are very difficult, complicated issues to deal with.
Yeah.
So in medical jargon, there are a lot of different ways to classify a wound. There are abrasions, lacerations, punctures, and avulsions.
Yeah.
So can you explain the difference between all those terms?
Sure.
And what is a dog bite normally classified as?
So an abrasion is basically a scrape. You fall down from a bicycle, you scrape your knee. It's usually not very deep. It often doesn't scar. And sometimes you have little pieces of dirt embedded there that have to be washed out, but usually local wound care, topical ointments is enough. A puncture is a stab wound. It's a little hole, but it can go pretty deep. So those are usually injuries that can be misleading sometimes. It looks like a tiny little hole. If you wait a day to have someone look at it, it may even be sealed up, but there could be injury deeper below. Then you have a laceration, which is a cut, and that's usually a slice, most often with something sharp. The avulsion is a rip of the tissue, and that's most often what you see with a dog bite, where the teeth grabbed onto some tissue and pulled at it till it tore. And that's why it's usually jagged rather than a clean cut laceration, and it's usually a bigger wound than a small puncture mark and deeper than a scrape, which is an abrasion.
So if you find yourself in a situation, or your child in a situation where they're bitten, what are some of the short and longer term things that somebody can do to help minimize or manage the scar going forward?
So, scar management in general, it can get pretty complicated, especially these days. We have so much technology. There are so many pads and creams and lotions, and as I say, lotions and potions and things you can put on it. In my experience, less is more, and there's a couple of things that have been proven to be helpful, and that's usually what I recommend, which I'll go into in a moment. And there's a lot of other things that make you feel like you're doing something, but they're probably not all that helpful and may even be hindering wound care. So the first thing is that the wound needs to be clean, infection needs to be prevented and controlled, and ultimately the wound needs to close. And then after that, you see what you're left with. If it's a wound that was open and had to be left open to close on its own, you're going to have usually a pretty wide and not very nice looking scar, which sometimes can just be cut out and reclosed to get a nicer scar later on. Once you have the final scar you're going to have, then the next question is, what do you do now to make it look better? So scars go through a lot of phases of wound healing. It takes about a year to two for a scar to be mature. So a lot of times people will say, well, this was 3 months ago, I don't like the way it looks. And I say, you don't even know how it's going to look yet because it's not done. In the first couple of months, it's a couple of things. So we know that silicone therapy helps. There are pads and there are gels. I usually recommend the gel. In the first couple of months, for a lot of people, this can be helpful, both for the texture and for the color of the wound. Beyond that, it doesn't do that much usually. The second thing that I recommend to everyone is sunblock. This is gospel. So the sun will get into your scar, and the scar tissue, as it's evolving, will pick up scar much more than the normal skin around it. And it does it little by little every day, so you don't notice it's happening. So just as that redness from the first few months is fading, it gets replaced with darkness from the sun, and it looked great at first, and you look at it 6 months later and now it's dark. And the problem with that is that hyperpigmentation or extra color is usually irreversible. If you try and use lightening creams, that gets into a whole other thing, and the skin around it might get too light, so on and so forth. So I recommend sunblock for at least 1 year for all wounds once they're closed. And it doesn't matter if it's raining, it doesn't matter if it's snowing. You can get a sunblock skiing, you can get a sunburn skiing, there's always sun.
Sure.
So I recommend that. And then the last thing with scar management in general is massage. Massage is key. In that year that the scar is becoming what it will be, you can tell it what to do. You can tell it, I want you to flatten, I want you to smooth, I want you to soften, I want the skin to not be so tight. And daily massage is, in my experience, one of those things that is always therapeutic.
Mm-hmm. So you just went through a lot of really excellent tips for scar management. I never knew the thing about massage and that you can tell a scar what to do. But, for wounds, I've heard a lot of people, wash it out, you want to put antiseptic spray on it, put a Band-Aid on it. What are some key steps for proper wound care?
So every wound is different, which is why it's important to have someone who is a wound care expert who can tell you what to do for your wound. But there are some general guidelines. In general, it's good to have the wound covered, at least in the first few weeks. It is also very good to have the wound be dry for the most part, which doesn't exclude putting on an ointment if you are recommended to. But having a big soupy wet wound is never a good thing. So dry is good, clean is good, covered at first is good. And then there's a point where you can have it exposed. The other thing is there's a lot of marketing out there for things like vitamin E and aloe and all of that, and people think that the more I put on it, the better it is, the more I spray on it, the better it is. The fact is, your wound knows what to do, and as long as you've controlled for things that will impair it, it will do the right thing. One interesting thing in particular with vitamin E, which has been studied like crazy and is in almost every ointment you can buy, in large quantities, it actually impairs wound healing. So there's a lot of things out there that are in everything and they're on every shelf, and it makes you feel like that's what you should be using. No matter what you're thinking of putting on your wound, you should speak with the doctor who's following your care to find out if that's the right thing or not. And no matter what your friend or family member or grandmother brought from abroad, don't rub it on the wound unless you were told it's the right thing to do, because I've seen it all and heard it all, and sometimes it hurts.
That's the potion part of your...
That's the potion part.
Yeah, exactly. So let's talk about our feline friends here for a minute. Do you see a lot of bites from cats?
We do. Not as many, but we do. And the interesting thing about cat bites is they are almost worse in the sense that they're very easy to underestimate. So dog teeth tend to be more blunt and they rip the tissue. Cat teeth are very long and very sharp and very pointy, and they puncture more than they tear. And the issue with that is you still have the same problem with the bacteria, except the tooth can get way deeper. And in spaces like the hand, the forearm, things like that, which is usually where you have the cat bite, there are these layers of tissue called fascia that separate out compartments, and one little bite can get those bacteria all the way down deep into the fascia. Looks like nothing from the outside, doesn't even hurt very much. People don't think much of it. They go home from the ER or they never come into the ER, and 24 hours later they have a rip-roaring infection that goes all the way up their arm. So with cat bites in general, I almost always admit the patients for overnight observation and IV antibiotics, because if you're not ahead of it, it can become out of control very quickly.
Yeah, that's amazing, right?
Yeah, I would imagine you'd have the same issue for cat scratches because their nails are kind of...
Cat scratches are also bad, but they don't usually get as deep as that tooth.
Yeah.
The tooth can get all the way down deep into the forearm.
So is that where the whole cat scratch fever comes in with Ted Nugent in the song? Is it the scratch and the infection?
I don't know about that.
You don't know? Okay. Well, I'll send you a link to the song.
I
and
have
then
to. I have to look into that.
We'll regroup afterwards. And
Sounds good.
We'll talk about that. Well, I hope, tonight when you go home, you don't show this episode to Tink.
Yeah.
Because we could have some fallout. You might get bitten and end up in the OR.
Well, know who to call.
An overnight stay with
Yeah.
IV antibiotics doesn't sound pleasant
Nope.
to me.
It's not the funnest thing you can do on a Saturday night.
No. So, going back to the health tips, remember those tips, right? Introduce yourself to the dog. Don't run away. Know the early warning signs, and hopefully you will be bitten free this summer and going forward. So, Dr. Sophie, thanks so much for coming in. It's really informative, and it's so good to see you.
It's great being here, as always.
Well, thank you, and I'd like to thank our viewers for tuning in. I've got to thank our sponsors for making today's show possible. Remember, all of our episodes can be found on demand at healthyo360.com, and our podcast can be found in the iTunes Store for your listening pleasure.
Well, we are all over social media. We love Facebook, Twitter, Instagram, and Pinterest. We use the hashtag #RealStories when posting. We'd greatly appreciate it if you would do the same. On behalf of Dave Duplay, myself, and the entire Healthyo360 family, we'd like to thank you for joining us today, and we look forward to seeing you again next week when we're chatting with Art Atenito all about his kidney transplant journey.